After a summer grappling with ambulance delays and record waiting times,
it's about how we get a better flow through the hospital system, which is something that benefits all patients.
In what is likely to be his last few days in the job, the Health Secretary urging the next Prime Minister to prioritise.
There's a very large number of people working in roles that are not patient-facing. And what I'm highlighting is that we will bring much greater transparency to those roles in the NHS that are not working in patient-facing roles, so we can have a better focus on, is that the key priority, or are we better investing in things that really impact on the patients?
We don't make appointments at front desk, we have a triage system.
Among the priorities, though, bringing down GP waiting times at surgeries like this one in Croydon.
Every winter, for years now, the NHS says we're going to face a hard winter. This year is no exception, especially with inflation and the energy crisis. These things have a huge impact on general practice. And if it has an impact on general practice, that's going to ripple through the whole system.
But it is images of ambulances queuing outside A&E that have laid bare the real challenge for the NHS. People who've had heart attacks or strokes in England this July waited an average of almost an hour from an ambulance. The NHS target is 18 minutes. In urgent calls, the average waiting time was more than 3 hours.
The NHS and social care are deeply intertwined. Patients are taking up beds in hospitals because there isn't enough space in care homes. That means the next cohort can't come in, and that's when we see ambulances queuing up outside.
Liz Truss saying she wants to divert some of the money from the NHS to social care. Can the NHS afford that?
Spend in one area has an impact on cost in another. So if, for example, there aren't sufficient domiciliary care places, then that often means that someone stays in the hospital much longer, and that manifests itself as a cost to the NHS. So my point is these are integrated.
So you think it's right to take that money away from the NHS?
So it's important that we're spending in, what I'm saying is where there's spending on social care, that often will have an impact on the costs in the NHS.
He's unlikely to be in the job much longer, but today a warning for his successor. The NHS can't do everything. Ali Fortescue, Sky News.